Hello, I'm Nelson Marquina. I'm going to be giving a presentation, a seminar at the Fall Convention in Green Bay. The title is Brain and Spinal Cord and PNS Dysfunctions, but it's focusing on centralized and neuropathic pain. In this short video, I want to give a sort of a flavor of what the seminar is about, and hopefully it will convince you to attend, definitely. This is just about myself. I'm a chiropractor, obviously. I used to be the director of research at Logan University for a while. But before chiropractic, I was coming from the physical sciences. My PhD is in systems engineering. I used to work for NASA and other companies like GE and so on. So back to this particular seminar, the objectives. I want to make sure this different way of presenting chronic and neuropathic pain, but really as a CNS and PNS dysfunction. I want to present the practical techniques for identifying, where to treat, where to put the handpiece on your laser, or to use ultrasound, E-stim, and all that for centralized chronic and neuropathic pain. And we will have a number of different machines in there, different lasers, different wavelengths, PMF machines, so you can see hands-on demonstrations. So you can develop or really expand to get you excited about treating CNS dysfunctions and neuropathic pain patients. Look there, why neuropathic pain? Look at the prevalence. Between low back pain, painful diabetic neuropathy, and post-herpetic neuralgia. So this is a big market right there. I've been working on all different kinds of pain, acute, chronic, neuropathic pain, and all that for many, many years now. It's probably at least about 16 years or so. But back to centralized pain. Yes, in the seminar, I'll discuss why chronic pain eventually becomes centralized, why that is the case. In fact, in some journals, talk about this, trigeminal neuralgia, they call it the suicide disease, because it's so relentless. And unfortunately, there's no options in conventional medicine. So yes, some of these patients do commit suicide. Your patients come in, they have, dog, my foot feels very cold, like ice. You measure temperature to put your hand in there. It is not. It looks like it's normal. It's a neuropathy at that point, or maybe neuropathy plus neuropathic pain at that point. So you have seen that. Patient comes in, has a particular pain. You do your adjustments, do E-stim, ultrasound, whatever you do in the practice. Patient comes back later on and says, Doc, what you did helped, but you know what? The pain came back. Why that is the case? We will address that. You will see that perhaps you need to address the centralized aspect of the pain. Otherwise, the pain will keep coming back. But you know what happened? I'm from Peru. I'm a southern boy. Anyway, I went back to Peru on vacation. It's about 12 years ago. And my uncle, my favorite uncle, who happens to be a medical doctor, and his wife is also a medical doctor. Anyway, he was diagnosed with subjective cognitive decline and has centralized pain. I knew about centralized pain. I'm a neuro guy. But I said, but what about this subjective cognitive decline? Why subjective? And how come they couldn't do anything about that? His wife or him, he was not able to think about rationally as a medical doctor anymore. So that became personal at that point. Says, now let me look at that. This is 12 years ago. Now look at today, moving today, real quick, 12 years. I've been looking at that issue, developing protocols, different techniques from the chiropractic perspective. And yes, we do have means of helping these patients that have no options now in the conventional medicine. Look at Wisconsin. Right now, cognitive decline, patients have been diagnosed with that already, almost 11%. So in this seminar, and it's going to be on September 22nd, by the way, that's a Thursday, we'll talk about treatment protocols using lasers, not just laser, but lasers and LED and or E-stim, pulse electromagnetic fields, vibration therapy, and so on. I use hands-on and video demonstration, different brands, different wavelengths, same thing for a pulse electromagnetic machine. We will have all that equipment in this seminar so you can actually feel how it is and see how it is used properly. Here's an video, so we of course use a lot of video for that. And even for centralized pain, yes, I show exactly where to put the handpiece, how long to treat on the brain itself. In many seminars, doctor will ask me, hey, I'm confused about lasers, laser therapy, how it works and all these things. So this seminar is not a laser therapy seminar. It is not. The neuropathic pain and neuropathies and chronic pains, we will address that kind of to clarify. A little bit confused, so we will briefly talk about lasers. And even then, I use a lot of analogies to explain lasers. No, people get confused with the math and all this thing about wavelengths, powers, energy, those. What are those things? I use a lot of analogies to illustrate so we understand what they are and how to use them. That's the main purpose of that. I will focus on how you can build, for those of you who have a laser, many of them already do that, how to build your own treatment tables of settings for different kinds of tissues, acute, chronic, and neuropathic pain. I really hope you come to this seminar on Thursday, September 22nd. It's going to be from 8 a.m. to 5 p.m. in Green Bay. So I hope to see you there. For now, see you later. Bye-bye.